All right, final session and the second half of what works. Some of this is going to be kind of discussion oriented, and some of it we're just going to go rapid fire through the things that worked for each of our panelists in different categories. And Cathy has joined us here. Thank you very much, Cathy, so we can get as much voice here as possible. All right, first topic is, how do we know something is working? And there's no right or wrong answers here. This is your experience. It's what are your criteria? What did you work out in your process? When do you decide if something's working? What's your doctor's role in that? Natalie, how about you? Go ahead and kick us off.
So this is, it's, as we all probably know, this is really complicated to figure out what's working, because I know we talked about this earlier. I can't remember which doctor talked about this, but talking about not trying too many things at once, because then you can't isolate what's working. But as we all know, we've probably been guilty of kind of throwing the whole kitchen sink at something. I see you guys nodding. Because when you're in a really desperate, pain-driven situation, you're just like desperate to throw everything at it. And so that can be really complicated and really kind of, I think, make the waters really murky. So I will definitely admit I am someone who has done that, and it's definitely complicated stuff. But I've also, kind of would narrow things down. It's like a painfully slow process, painfully slow to figure out what works and what doesn't. And a lot of it is just so much trial and error, trying to isolate like different variables, which is really hard, in real life. And it's honestly like, I know I'd mentioned this earlier, but it was only, I started having dry eye in 2011. It was only like this year, basically, that I started actually making strides in some of my underlying systemic conditions. And so a lot of it is just trying to, and I know I keep harping on this, but understanding like what the things you're doing are doing. Like understand how Tirvaya works. Like understand that, and so that you can see, hey, I'm gonna try Tirvaya. Like if I need to try it for a certain period of time, and then if it's not working, I can't say that it doesn't work, but I can say maybe it's not working now for a certain reason. And so like I kind of always hold things really loosely. I try not to be super black and white. I try to be nuanced. I try to think of all the various reasons, like investigate, think, challenge my own thinking for why something may or may not work. And then when I start to feel a reduction in pain, I start to see a reduction in visible redness, I start to feel oil. I don't know if you guys have felt this sensation of using a warm compress and you feel oil feels different than watery tears. You can kind of sense the difference, and so you can feel oil coming out. So when I would actually feel oil coming out, like those kind of things, and it's just a lot of feeling it out, a lot of like painfully slow, like, investigation. So it's an interesting process for sure.
Awesome, thank you. Ruth, what's your take on this? What's your experience?
I guess firstly, oil does feel different, because when my optometrist does manual expression, I kind of go, ah.
Can you talk?
Oh, sorry. So I concur, oil's the same. For me, it's really simple. Do my eyes feel wetter, and is my pain less, is how I grade whether it's worked or not. When I see my eye doctor, my eyes always look relatively calm, so I can't really be guided by physical symptoms. When they're really bad, they go red, but whenever he looks at them, he says, your eyes look, I think he uses the word quiet, your eyes look quiet, he says. So for me, it's, do my eyes feel more moist, and does the pain go? And I have probably a reasonably scientific approach in that I do only change one thing at a time, and I also make sure I try something for long enough to get the consistency. The only time that has failed me is I tried Icurvis, which is the European form of cyclosporin, for way longer than I should have done when I wasn't tolerating it. But that error withstanding, I've been reasonably consistent. Does it make me feel better? It's as simple as that.
So can you put a number on long enough?
Depends on what it is. So for something like cyclosporin, I tried that I tried it for 6 months. It wasn't working at 3 months. I should have stopped at 3 months. For a drop, I would give it, a new lubricant drop, I would give it, at least 6 weeks, to sort of 4 to 6 weeks to know if it's making a difference or not. With medication, oral medication, longer. It took me a long time to find an oral painkiller for neuropathic pain that worked because of how long you have to leave it to see whether it's going to do the job.
Okay, lubricant drops. Sorry, I'm going to stop right there and ask the rest of you. How long everybody's tried lots of drops, right? How long do you give it for a lubricant drop? How long? Just, you got a number? Would it be?
I mean, if it starts hurting real bad right away, then I'm kind of cautious. Yeah. It's a little bit like, maybe let's set this aside. Now, there could be other variables that day. Maybe I slept poorly. Maybe, like hormonal things and stuff like that. So I don't fully take it out of the running, but it's definitely something that I'm like less hesitant. But if it's something, like I recently started using a high molecular weight hyaluronic acid eye drop, and I didn't feel bad when I started using it. So I kept using it and I kept using it. And then I started noticing after about like maybe a month, like some positive effects of it. So it's so dependent. I feel like it's so specific.
So longer may be better for lubricant drops as long as
as long as you're not feeling
bad.
Like horrible reactions right away. Because if you're feeling horrible reactions, you maybe shouldn't push it.
Absolutely. I wouldn't try something for 6 weeks because some of them I'm quite sensitive to the buffers in them. And so if I use borate, my eyes will go bright red and tear immediately. So I would obviously...
I'm the same.
Yeah.
Borate
and citrates for me.
For me, at least.
Borate is a very common ingredient used to adjust the pH in eye drops. There are other alternatives.
Bright red and stream, so they're straight, well, I just don't buy them now, but earlier, straight in the bin, basically.
And how did you, I don't want to stall too long on this, but how did you figure out that you were sensitive to borate specifically? I mean, there's a lot of ingredients in those drops.
Trying several eye drops that didn't work for me and looking at the ingredients and working out what was the common denominator is the answer. And then I knew it when I tried some buffered saline, and it was buffered with borate, and just saline shouldn't make your eyes go bright red and stream, and it did. So then the penny dropped. I was like, because no one talks to you about buffers.
We have Dr. Brown I think is gone now, but she's got a blog post on dryeyezone.com that is actually all about those additional ingredients in artificial tears, by the way. Cathy and Justin and Ben, artificial tears, how long would you give it when you try a new drop?
Artificial tears, a week. And my answer to how do I know something's working is pretty simple. Do I feel better? And how much time generally would I give it? About 3 months.
3 months, okay.
Yeah, I'm kind of similar. I give it about 2 weeks max. But I think everybody's sensitivity levels are different. So I think you need to try to make a decision on what works best for you. Like I can tell a shoe that isn't going to feel good the second I put it on my foot. It doesn't matter how long I wear it for, it's not going to feel good. So with drops for me, like 2 weeks tops. But similarly with like a gabapentin or duloxetine or like some biologic, I might sort of be willing to go for like 2 or 3 months, but that's always a conversation with my doctor on like figuring out what that regimen looks like for like the experimental protocol. But I had the same situation happen to me. I was on Restasis for probably 2 years, like years and years and years ago, and it was just painful, uncomfortable, and doing absolutely nothing, but I didn't know the difference. So I've become a little bit more of a skeptic, but I try to ground that in sort of like an experimental process.
Can I pause for just 1 second on Restasis? Because I know at some level Restasis has gotten pretty beat up today, but there's also positive sides there. Restasis was the first drug approved for dry eye, and this was back in 2003, roughly. So more than 20 years out there. And there are many people that I know for whom it has worked very well. But then there's all the rest of us. And just because it was the only thing for so long, there was a completely different effect on how people related to Restasis versus when the industry flood came, when there were so many other options, right? One of the things that we tended to hear all the time from people was, I have no idea whether it's helping, but I'm afraid to stop. That's something that I always I think that can be true of many things on our dry eye journeys, but it was something I always personally related to the kind of Restasis era before other therapeutics became available.
And I don't know if you remember, I'm one of the people who has benefited from Restasis. So when I heard the doctors, say 15% of people benefit, and I thought, I don't care. I was one of those 15%. It's just like LASIK. When LASIK was 95% effective, at the time I had it, it was 99% effective. I don't care. I was in the 1%. So sometimes I'm a real mathematical person, but sometimes the statistics don't tell the whole story if you're in that 1% or if you're in that 15%, for the good or the bad.
If it's 100% of me, I'm good with that. I don't care what it is on paper. Right? Ben?
Sure. So for me, my timelines, I think, are quite a bit shorter than it sounds like other folks up here, at least like in retrospect. This is the approach that I've taken. I think I could very quickly discount a lubricant eye drop as not effective for me, but it took me longer to believe that a drop could be like part of my regular regimen and like would work for me, if that makes sense. Like if something didn't work within like definitely didn't work within like the first day or two, I would not use it again. But if something seemed like it was helping, I would continue to use it, and then it would become my regular drop after like maybe a week or two. Yeah. And then in terms of, and then in terms of like generally how I knew that something was working. So for me, basically nothing worked except for things that protected, like in various ways protected the actual surface of my eye from the elements and exposure, which, kind of over time confirmed that was the issue. I adopted those things insofar as like I woke up the next day and my eyes were a little bit, better. Or just like, things that protected them from like air conditioning or wind like helped. And then my ultimate, obviously, like decision was, well, I kind of want something that protects my eyes all the time. And I don't have to like deal with, for the rest of my life. And so that's why I ended up doing surgery. But the only things that really helped were those things that protected my eyes. And so those were the things that I like paid attention to, how much they were helping when I like woke up or when I would otherwise have been exposing my ocular surface.
I just wanted to add a quick point. Like a lot of us here in this room, definitely myself, like I'm a sucker for hope. Like I will pay you money if you offer me hope and you deliver it in confidence. And I have done that so many times. And it's okay, like, it's like a normal human thing. But like I loved what Dr. Jacobs said, like I tried sclerals 5 times at 5 different centers. And some of the recommendations were to try to wear it for 2 hours a day, try to work up to an entire day of wear. And I was in so much pain while I had those sclerals in. And it was like my normal dry eye pain, and then the scleral lens was like up here. And I think I was a little bit too much of a sucker for hope. And so I think it's important to like have hope. You need it to survive, and you need it to like, have a positive outlook. So like don't lose that hope, but also be grounded in what's being offered and make sure you're educating yourself in the realities of what it can offer you. And then be realistic about your timeline for, calling a spade. Yeah, this isn't working. Let's try something else.
If I may add to that briefly, not exactly related to hope, but I think, again, reflecting in retrospect, my timeline or my patience for different solutions really did depend on what my doctor told me in regards to how quickly they would they would work. I mean, like, I was talking to Dr. Jacobs earlier, and she was like, were you on Restasis? Were you on anything cyclosporine? I was on Cequa for years, which made zero sense for someone with, chronic lipophthalmos, right? Chronic exposure of the ocular surface. But I was told by my doctors that it was just a very gradual thing, right? That at the earliest I would see benefits within a few months, and really it's just the way it works is the consistent application of the drops twice daily. So I believed, I had hoped that would give me some marginal benefit because of what my doctor told me. There are other examples of that. I do think that I very much heeded the words of my doctors in terms of calibrating my patients for different treatments. So
part of what I'm hearing here is some of it is the information we take in or research for ourselves, and some of it is, I'm going to go back to one of the early dry eye happy hour sessions in the pandemic. My friend Rob from New York, I can still hear his voice in my ear from that session, where he said, when you're in pain, you make less informed decisions. And yeah, I think we've all experienced, many of us have experienced something like that. One thing on one of the drugs that I wanted to circle back to, Cathy, I remember we talked about this recently, but I can't remember if it came up today, Restasis. My recollection is you tried it way early on and it did not help at that time, but it did later.
That's right. And so to give you an analogy, when I was dean and I didn't get something that I asked for, usually money, I would tell the people that reported to me, that no doesn't really mean no. No just means no right now. So we'll go for it again. And the treatment of Restasis was something I had tried earlier and it didn't work. But 5 years later, I tried it again and it did work. So sometimes I had, and I don't know if you have this, I had a mental list of the things I tried and didn't work. And all that means is it doesn't work right now with your current body. But our bodies change and our circumstances change. So no doesn't always mean no. It just means no right now.
Can I add to that really fast?
Yeah, please.
I couldn't tolerate sclerals at first, corneal neuropathic pain, inflammation. I couldn't tolerate them. I was trying the standard fill solutions like scleral fill and Adipac and all that. Well, then I tried Neutrophil, and this is a tip I say to a lot of people when they say they can't tolerate sclerals, even with neurocorneopathic pain. And I say, well, have you tried Neutrophil? It's different buffer, phosphate, it has some electrolytes in it. And unfortunately, of course, the downside of this tip is that it's not available right now. But it will come back, and that is something that I do encourage people to maybe consider. Maybe it won't work for you, but it is something that worked for me when I thought I just couldn't tolerate sclerals. So you just never know. It's so specific to the person.
There are so many variations on the theme of things. Yes, with sclerals, there's the cleaning solutions, the filling solutions, the details of it. With cyclosporin, we've got 3 versions of cyclosporin on the U.S. market now, and what I'm hearing from people is significantly different responses depending which ones they're on, right down to the goggles and glasses and gear that we use. There are a lot of options, and sometimes if you tried one variation of something, it doesn't mean you rule out the entire thing or class of things. All right, what we're going to do next is a little bit more rapid fire. We're going to take a whole kind of class of things like drugs, and that could be topical drugs or systemic drugs, or specific things like plugs or solutions for nighttime dry eye or whatever. We'll take a class of things and we're just going to run down the line and say, here's the things in that category that worked for me. No commentary, just yes or no. So what I'm defining as it helped me here is for a significant period of time, this was an important thing to me. You don't need to be using it now, but was there a point in time, say I was in my roughest period, and this thing got me through 6 months of it, okay? So stuff that helped you, because I just want to get a sense of the variety of things that may have helped us. So let's start with drugs. Natalie, drugs. What drugs helped you?
Just go rapid fire down
Yep.
the list. Xdemvy, cromolyn sodium oral, cromolyn sodium eye drops, Vivi, Tyrvaya, lid wipes. It's called Comfort Shield, hyaluronic
just
acid.
drugs, sorry, like prescription drugs.
Okay, sorry.
Yeah.
Well, you got all that too, so.
Thank you. All right, Ruth, and I know you've got different names over there, but
So prescription drugs, nortriptyline for neuropathic pain, I did really well on that. Cyclosporin, but in a different format to Icurvis, something called Optimune. It's a veterinary product. Ask me afterwards, I'll explain why. Steroids, topical steroids in the eye, preservative-free, and serum tears, because they're prescribed as well.
Restasis, gabapentin, and what you just said, which I've forgotten already. What's it? No, I forgot it.
nortriptyline?
No,
Nope.
I forgot. Pass.
Okay.
For me, none of the prescription drugs have ever helped.
Same. None of the prescription drugs ever helped, even though I tried multiple.
Steroid drops. I remembered it.
All right, next, plugs and cautery. So any form of occluding your tear ducts.
Has not worked for me, unfortunately. Just kind of trapped all my inflammation. So I've tried plugs, haven't done cautery, tried Lacrophil, but they all just made me more inflamed.
I love both. So I had plugs, I had 2, then I have 4. Then I had recurrent things called pyogenic granulomas, which little monsters which spat them out constantly. So I've had cautery of my lower ducts, and if it ever comes to it, I'll have the upper ones done as well.
Plugs, all 4, super helpful. Cautery, top 2.
I've tried all the plugs, and now all 4 of my ducts are cauterized, and for me, that was massively, massively helpful, with some side effects, but overall, very helpful.
I tried plugs. I think they were dissolvable plugs, and they didn't help me.
All right, next we're going to go to MGD in-office treatments. I know some of you may have felt like this topic has gotten a little demonized today. It wasn't the intention of it. Now's your chance to fill in the gaps and say what's worked for you. So this would be everything from LipiFlow, IPL, LLT, iLux, tear care, all of these sorts of treatments. Natalie?
The top 2 for me would have to be IPL, directly on upper and lower eyelids with the corneal shields, and then meibomian gland probing.
Probing. Thanks.
IPL, I think it probably worked. I've never had my uppers done because I'm too scared of the corneal shields. So I've started having low-level light therapy, but probably not enough to say it's worked or not. And just the nicest thing is when my optometrist just gently debrides my lid and I feel the oil come into my eye, and I actually make a kind of slightly kind of like noise. So just scraping my eyelids.
Only thing I've ever tried is lid scrubs, and not sure if they were helpful.
I've done all of the above, IPL, gland expression. IPL, I would say marginal benefit. The expressions I find are also marginally beneficial, and then I do heat once a day, and I find that that's marginally helpful. So kind of look at this class area as, like, for me, like adding a little bit here and there.
Yeah, so for me, I did LipiFlow and IPL. And expression after IPL. So for me, I had to approach it as sort of trying to maintain my glands until my eyelids could properly occlude, rather than like the lack of oil being the issue that caused my symptoms, because regardless, my eyelids were not touching and expressing the oil, each time you blink. So I did both, but I actually didn't see benefit, obviously, till my surgery. One thing that was really interesting was I did LipiView, a few times along the way, and I saw after my surgery that my glands looked better. I would like to think that's because my eyelids were now touching, and therefore there was kind of the constant expression of the glands. But I don't know. They looked better on LipiView.
All right, now we're going to move away from treatments per se and more into functional stuff. So and this may involve the treatments, but for those of you who have struggled with dry eye at night specifically, waking up in the middle of the night or waking up in the morning with your lids stuck shut, if the night has been a significant challenge, what items, whether it's drugs or consumer products or whatever, what helped? Is that and you only need to answer if this has been an issue for you.
Okay. A night ointment, so I like High-Low Night, which you can now get here. That wasn't sponsored. And night goggles as well. I use the iSeal 4.0. They work really well for me.
I wear night goggles.
Nighttime was probably worse for me than daytime, but I have a little bit of log ophthalmos, so Muro 128 has been a lifesaver for me, and then a nighttime sleep mask, moisture chamber goggle.
So moisture chambers did not work for me. They wouldn't stay on. They wouldn't, also when my eyes were kind of more bulgy, they would sometimes rub against the surface. They just didn't really work for me. What worked for me was and this was before you released your thing. This was a sleep mask that had some room for the eyeballs in it that just felt more comfortable and blocked the movement of the air, didn't necessarily trap the moisture in. I just got a regular sleep mask. That helped some. And to be honest, and I know this is before I heard kind of all the discussions about this, since then, castor oil I think did help me. I would just kind of glob it on before I went to bed, and the just literal protection, whatever moisture that it would provide. I mean, it was a little messy, but it would help. I understand that's that just kind of showed how desperate I was. I was trying everything. I know since then that's been a little bit of a questionable thing to do, but I do that was a big part of my regimen for a while. Castor oil, sleep mask, go to sleep. Yeah.
Awesome. Any more to try? Okay. Next, then, any of you struggle with driving in your journey?
You said driving.
Driving. In that I can't drive for more than about 45 to 60 minutes without having to stop to put eye drops in. And when I had 4 punctal plugs, I got a little bit of over-tearing, and that I couldn't drive. So, because they got too much, because I was wearing them with moisture chamber glasses as well, because I'm so sensitive to air currents. So that didn't work.
I'm able to drive more now than I was previously. My husband is often the designated driver. Well, I don't mean in that sense. You get what I mean for that reason. But so I'm kind of become a passenger princess in our relationship. But he's driven me to eye appointments because I just haven't been able to. And yeah, it's better now, but not long distances. So
thanks, everybody. All right. Here's a big one: computer use. What has helped you to be able, for those who've continued using computers or use them a lot, what has helped to make that doable or more comfortable?
So I work a lot on a computer, unfortunately, and the top things that have helped me are working from home, which I know is not always available to everybody, but that's huge because then I can control my environment and I feel less, weird about doing, eye routines and stuff. So that was huge for me. Obviously that's situational for everybody. And then just trying to, I'll shift my screen depending on the day. I won't make it super bright depending on what I'm doing. That sometimes helps. I'll shift it to, there's a filter that I do on my Mac that shifts it, skews it to red. especially as I get closer and closer to the evening. That can kind of help with eye strain and things like that. A lot of it's honestly just really hard because the reality is I still have to work. And there are days when it's really, really difficult. And Connie reminded me, and I probably shouldn't be admitting this, but I honestly, on my worst desperation days, I would just work from the bathtub with my little laptop on this like slat because the humidity was my only savior. And it's actually really sad, you know, that we have to like come up with creative solutions like that, but it's not a bad tip, just to let you know.
I obviously took the nuclear option and changed jobs, but I mean, to be fair, radiology monitor, you can't alter the brightness, and they are really, really bright. So my laptop, as you say, putting it onto warm mode, putting things onto dark mode, because I find white text on a black background much easier than black on white. Making things really big, so blowing the font up. And obviously now I'm a student again, I have got an extremely supportive university. They will print everything out for me, and they'll blow, certainly if I want to read academic papers, which tend to have really tiny font size, they will basically blow it up and print a table out on A3 for me. Dictation, so I don't type, I dictate everything, and screen reading software, and I've stopped reading books because that hurts, so I've gone to audiobooks, so I tend to use a lot of work around through dictation and listening, which is hard because I'm a visual learner, but, you know, it could be worse, so, yeah.
I actually forgot about this, but 25 years ago when I did this, I was on the screen all the time, and our Office of Disabilities came in and they set up my screen so it would read to me. I completely forgot about it because now we can just talk to it and it can talk back, but 25 years ago the technology wasn't that great. But more recently, I wear goggles, I make sure the screen is lower than I am, so I'm looking down and not up, so my eyes aren't completely open, and then I take a lot of breaks looking out of the window.
It's definitely been a challenge for me. I would say the punctal plugs for me have helped a lot because it builds sort of like a tear reservoir, and I kind of like dip down into it, like intentionally, by looking down. If I need to, and that helps. I'm also I try to be a little bit more conscious about how I blink, and make sure that my lids are touching properly. But then I'm also trying to be more conscious of not using screens. Like if we go on vacation, I'm like phones, I'm not looking at that for the whole week, and it helps a lot. So I would say, just be more mindful of screen usage.
So looking down at my computer is something that I did. I almost forgot about that. I moved my computer to part of my apartment that had kind of the least air movement. I actually moved it into my walk-through closet. And it was also helpful just like for my focus. But that helped. And then I would also, I put a humidifier next to my computer at work. People definitely teased me for that, but you know, it helped a little bit, I think. And at home, I had a humidifier, you know, that I could like really increase the humidity of my walk-through closet because it was like a small space. Or I would just honestly run the shower really hot. And I had a humidistat that, you know, would tell me that it got to a certain level that typically I felt comfortable with, and that helped. Obviously, it wasn't sustainable, either, you know, literally or environmentally, but that was a strategy that I used on like bad days when I had to use the computer.
All right, now very briefly, how do you stay comfortable outdoors for those for whom this is a challenge? And if your answer is glasses, tell us the brand. Natalie.
So I moved from this general area to Colorado 2 years ago. It's very dry, it's very windy, it's not conducive at all for this condition. So I had to completely rethink my strategy. This is when I was pregnant, and I mentioned earlier I was wearing motorcycle goggles because I tried the various moisture chamber glasses, but I felt like, I was pretty severe, and so I felt like the cups, I have a kind of more narrow face, I feel like the cups just didn't really accommodate the shape of my face, so I still felt, airflow inside. So I just went straight to like foam, Guard Dogs is the brand, very attractive, if anybody wants to look it up. But they're well made, you can pop in and out the lenses, and I just wore those, and then now I do sclerals. And I'll also try not to go out on really windy days, which is really hard in Colorado sometimes. And then I'll often wear a hat so that if I need to in the wind, I can put. Sorry, I'm going with I can put my head down. And block it.
So we're going to go to like 1 or 2 word ones now because I just want to squeeze in a couple other things. That's great. Thank you.
So I wear moisture chamber glasses all the time. These are Zyena Marinas. And if I go outside and it's really windy, I use 7 Eyes because you get a better seal.
7 Eye Viento, used them bicycling all the way across America with a constant headwind and camped. So for 52 days, had those things on round the clock.
I actually use Smith sunglasses that are for mountaineering. That have like a protective thing on the side. But I'm able to get away with that because I have my punctal ducts closed and I have more than enough tears. So that's kind of how I do it.
I used Speedo goggles, swim goggles, like 5-6 years ago, walking around DC. Didn't have to use them very often, but when I went out and it was super windy, that's what I used.
All right, one last question of this kind, and then we're going to go to everyone's just wrap-up comment, your brief last best advice for people who are in this journey. So this last question is, in dealing with the mental health impact, can you narrow it down to the one top thing that was most helpful to you at a critical time?
Oh my gosh.
Anybody jump in at any time.
Exercise.
Mindfulness.
Honestly, I know I've been harping on this, but for me, it was just taking control of my, education, learning about the condition.
Latin dance and exercise.
For me also, I would say meditation and mindfulness.
All right, awesome. We are coming close to a close here today, so just want everyone to have one last chance for sharing, like I said, if possible, your best advice to people who might be right now where you were at some point that you emerged from.
So I know I'm a broken record, but I just cannot emphasize this enough. Remain very curious and be very determined and continue to learn. Honestly, I just cannot express it enough. It's the number one thing that helped me and saved me was understanding so that I could figure out how to basically bring myself out of the dry hell. So you have to be doggedly curious.
I'm going to echo the advice you gave me because it was true, which was it will get better. It might not be a cure, but you'll get to a point where you have quality of life back, and it will take time, so be patient, because that was very useful. So I will pass on that advice.
I'd say pay attention to your mental health, because I think we've heard from doctors today that says pain and your mental health are it's all just one big ball. And sometimes I felt like I couldn't control the physical pain, but I could at least work on the mental health.
I think my biggest point would be build a team for yourself. A team. Somebody put up a chart. Maybe you had the chart of the friends, family, care providers. You need a whole team around you to support you. And if people aren't supporting you in the way that you need, it's fine. You don't need to angrily throw them up, but move them aside and bring somebody else onto the team that can help you keep moving in the right direction.
So for me, I really think the unique things that I can mention are patient-to-patient conversations. I mean, they're constantly happening, yesterday and today, but like more of those, I think I would encourage. Those led to the pivotal decisions along my journey, the like epiphanies, decisions about who to see, who not to see, what questions to ask. So patient-to-patient conversations. And then, honestly, this is like a weirdly specific thing. I mentioned this a little bit earlier, but I think it was a game changer for me. Really understanding your insurance policy. I took the time to do that. I like read the clinical policy bulletin, understood what the CPT codes were. This saved me hundreds of thousands of dollars. It might not be hundreds of thousands for you, but maybe single-digit thousands, tens of thousands. It was a game changer, and I think that's like a very specific piece of advice that I can give. And I'm happy to talk more about that too, if you want to find me. There are certain strategies you can take, yeah.
All right, so we are wrapping up here, and I do not have words to say how grateful I am to all of you for being part of this experiment, this event, this making yourselves vulnerable, reaching into those places that are, not comfortable places for us to touch, and bringing just the wealth of your experience and wisdom to the table here. Thank you for what you've done for everyone here and everyone watching. All right, I'm going to hand over to Aiden in a minute to wrap us up. I don't know where this thing is going. I just want to say again, thank you everybody for being part of this, for being here. One of the person that I need to thank most for all of this is Aiden, who you could not imagine how much he has carried over the past months and every detail he has looked after. And it's just been enormous. We would not be here without his dedication and sensitivity and thoughtfulness in everything from wrestling through details of what our program was going to be to all of the people wrangling to the facility planning and 100,000 other things. So can we thank Aiden for all the work he put in? All right, Aiden, can you wrap us up the list?
Oh, we don't have speaker notes. All right. Well, I'll say it. Stay connected. We're here. We're here for you. We're here to help. We're here 9 to 5, I'll say, Monday through Friday, but we'll do what we can. So email us, info@dryefoundation.org. Text us, call us, 800-484-0244. I hardly have gotten any sleep this weekend, but I want to spend the rest of the night connecting with people. I appreciate all of your time and energy and everything that you put into coming today. And so let's just keep doing this. Let's stay connected. This is some of the things we're trying to do at the Dry Eye Foundation. We have Zoom groups that meet several times a month. It's actually like a dream come true to meet some of the people that I've been getting to know on Zoom for the past several years. Seeing them in person, connecting to each other too, has been wonderful. So join a support group. Call our helpline. The 800 number will also get you scheduled for a call with Rebecca. I can talk to you first and take some notes, and we can do whatever it takes, whether it's one call or multiple calls or emails or sending you some articles. I think it's important just to be the people who understand, that have the experience, and to do something. We have to ask for help. If we've helped you in any way, when you're able, if you're able, we really would appreciate a donation or some way. If you can think of it, a company match or volunteering. I think there's going to be so many jobs after this, from organizing next year's Advocacy Day to, I still got to make a survey for all of you to see how it went, to just keeping in touch. So please reach out if you're able to do anything extra as well. That's the end of my slides, so I just appreciate you all so much, and looking forward to staying in touch. How many times did I say that? All right, thanks everyone.